Thankfully, in children, there's lots of interventions and treatments that we can do that are very, very successful, and especially in gastroenterology. But equally so, there's a lot of unknown, and that is what drives me, that we still don't know a lot of things, and a lot of things that need to be developed in this specialty that attracts me to it. Hello, my name is Dr. Amit Saha. I'm a pediatric gastroenterologist. I am currently based in Perth, working in Hollywood Hospital and Midland Private Hospital as a pediatric gastroenterologist. I also do some general pediatric work at Midland Hospital as well. I trained in the NHS in the UK, and I was initially an emergency medicine trainee. However, one of the things that I got involved with one of my supervisors when I was still in training was to do with identifying the needs and training needs of all the gastroenterology spin training doctors in the UK. And these are the ones who wanted to take on gastroenterology as an interest, but not as a career. And then we developed a curriculum for it. And in that process, I got really interested in the gastroenterology side of things, and I had applied for what we call as the National Grid Training Program in the UK, and I was successful, and I got trained in pediatric gastroenterology in that way. After I finished my training in the UK, we made a trip as a family to Perth to visit some friends. And while I was visiting Perth, one of my colleagues from Perth made me a job offer, and I thought we will try it out for a year. But that year has never finished. Now we are 8 years into it, and we are now Australian citizens, and we love Perth, and there's no going back. The work that I do is with children, and that has always been a great attraction for me, because it's very fulfilling and to see children that bounce back from illnesses, and the happiness that is in their eyes and in the parents' eyes when things start going right after they have been through a bad patch. So thankfully, in children, there's lots of interventions and treatments that we can do that are very, very successful, and especially in gastroenterology. But equally so, there's a lot of unknown, and that is what drives me, that we still don't know a lot of things, and a lot of things that need to be developed in this specialty that attracts me to it. So more recently, I've been involved in studying the microbiome side of things, especially in the first 1,000 days of life. And I found this very interesting, that there is such a lot of research going on in this area and robust evidence behind it. And we really need to go to the next level and capitalize those and make it translational into clinical practice. However, we are aware that a lot more needs to be done in terms of clinical research, and that is currently my really area of interest. The most recent trend that I have seen, and which has surprised me, is the incidence of eosinophilic esophagitis in autistic children. And so eosinophilic esophagitis is a condition where the esophagus, which is the food pipe, gets affected, and the motility is affected, which causes problems in swallowing, and children don't want to eat, and they present as fussy eating. However, most of the time in autistic children, this has been ascribed to their sensory needs rather than anything physical. However, I have a low threshold of doing endoscopies in these children, and I found lots of children who actually have ongoing active eosinophilic esophagitis as an underlying cause. So the association between autism and eosinophilic esophagitis is now an area of major research, and a lot of publications are coming out. So that has been a trend that I have experienced as well recently, which was a surprise for me. As a pediatrician, if you want to do subspecialty in pediatric gastroenterology, there is lots of opportunities throughout Australia, and it's important to remember that pediatric gastroenterology also includes hepatology in Australia. So we have to know about the gut and the liver together. And it is quite a rewarding specialty after you've finished your training, because it is part medical and part surgical. And if you if you've got good hand-eye coordination and enjoy endoscopies, it can be very rewarding on a day-to-day basis as well. In the United Kingdom, I went through a training program in pediatrics called the GRID training, which is 6 years of pediatric trainings followed by 3 to 4 more years of pediatric gastroenterology training in total. However, in Australia, what I've observed is that the training program is not very streamlined or integrated. It can be quite fragmented. So there is anxiety amongst trainees about progression and about opportunities. Perhaps the colleges can get involved and streamline this process so that it is less anxiety provoking and more predictable for trainees who want to pursue this career. After coming to Australia, it has been a huge lifestyle change. First of all, I can park my car anywhere, which was not the case in London at all. And the outdoor life has been fantastic. I can go out to the beaches and outdoors with my kids. And when I first came to Australia, my daughter used to go to the local school in a slippers, which was unheard of in the UK. So a lot has changed, and I feel that the kids find a lot of more grounded in nature after coming to Australia, and we have found that this lifestyle suits us much better. So outside of work, I play cricket every weekend with a group, and it's called as Last Man Standing. It's good fun, but obviously it's a bit dependent on weather. So that is where I unwind ourselves with close friends.